My name is Dr. Matthew Mian, and I'm a neurosurgeon at Swedish Medical Center. And one of my specialties is the surgical care of patients with epilepsy or seizures. We have different treatment options. So some options are non-destructive, meaning generally we just stimulate with electricity the nervous system to try to interrupt those seizures. But in some cases, we can offer patients a cure by damaging or removing the tissue that we found was causing the seizures. Historically, the main thing that we did in circumstances like this was open up the skull with something called a craniotomy, where we drilled an opening in the skull to go in and remove the tissue that we thought was causing the seizures. The procedure we undertook in this case is slightly different. It's called a laser ablation or laser interstitial thermal therapy. And it's a procedure where we introduce, instead of through a big opening in the skull, through a very tiny opening, a laser probe. And the laser goes into the part of the brain that we think is diseased, that is causing the seizures, and we burn that tissue. This young man's procedure took a few hours. It consists of two parts. We start in the operating room, and we insert a tiny bolt into the skull. And this bolt really serves to aim the laser fiber at the target in the brain. And the laser catheter is a really tiny probe. It's about 1 millimeter wide, and we use a surgical robot to implant this laser fiber with millimeter accuracy. The probe goes deep into the brain, and we use a CAT scan to confirm in the operating room that we've targeted the area that we want the probe to end up in. Once we've confirmed placement of the laser probe, we take the patient to an MRI scanner, and that's where we perform the ablation or the burning of the brain tissue. What happens in the ablation is that the laser diffuses from the tip of this, and it heats up the surrounding tissue. So we're going to heat this area, and what we do as we heat it is we're going to see that this orange blob starts to expand. And eventually we're able to see that we've heated up the tissue enough that it's been irreversibly damaged. So one of the advantages of the laser is that it offers us an automatic safety valve, so to speak. So we can place little targets around the area that we want to burn, and we can understand when the temperature in those targets reaches a critical level. So in that way, we can avoid heating structures that we don't want to damage and only focus on the area that we're trying to treat. So the patient did very well from this procedure. He was able to go home the following morning. He had no adverse effects from the procedure, no side effects as best we could tell. And I just saw him in the office yesterday. We were about 2 weeks after the procedure, and happy to report that so far he has not had a single seizure. So laser ablation is a relatively new procedure. We've been using it in the brain for only a few years, and I've been doing this procedure for about 2 years. We're one of the only centers in Colorado and in the greater region that performs this procedure. Patients can potentially be cured with the laser. So if we're able to destroy the tissue that's causing the seizures, oftentimes these patients can come off of medicines and they can live the rest of their life free of seizures. And ultimately, seizure freedom is always our goal in taking care of these patients.